Thank you very much. Well, 16 fringe meetings done. The marathon's almost complete. But before the end, I want to deal with an issue that I feel very passionately about. During the last 3 days, the Health Hotel has debated an enormous range of really important issues, but there was one particular session which left and will leave a lasting impression on me. On Monday, we heard from Angela, who has suffered mental health problems, and she gave the most remarkably powerful testimony, some of you may have been there, about her experience of the system and how it has failed her, the extent to which she has been ignored, the extent to which no one listened, left waiting for far too long, a desperately depressing experience, and left unemployed as a result of her condition for far too long. And I was struck, dismayed really, by the criminal waste of human talent that people in Angela's position demonstrate. And the story that Angela told is depressingly repeated far too often. 1 in 4 of us will suffer some sort of mental health problem at some stage in our lives. Probably all of us here in this hall and the families that we come from are touched by mental health issues. 6 million people in England, 6 million adults today are suffering today from some sort of mental health problem. The cost to the economy is estimated at a remarkable £48 billion a year. And what leaves me utterly confused is why, despite all of that, so little attention is given to the issue of mental health. It seems to me there's almost a conspiracy of silence from political parties and from the media in simply refusing to talk about the unacceptable state of our mental health services. And so I'm proud, Liberal Democrats, that we are taking the lead on this issue. I'm proud that Nick Clegg, our leader, chose to focus on mental health. I'm proud that he raised it in Prime Minister's questions and that he devoted a whole speech to the subject of mental health, probably the first leader to have done so for very many years. And I'm pleased also that the key mental health charities have warmly supported what is contained within this motion that we're debating this morning. Liberal Democrats, this motion seeks to establish 4 fundamental principles: equality, fairness, empowerment and quality. But I want to focus particularly on a very simple but compelling case, that those who suffer mental health problems should be treated equally with those who suffer from physical health problems. It ought to be a statement of the obvious that that should be the case, but sadly, the reality is very different. The finances within the NHS are skewed away from mental health. The combination of payment by results and the imposition of the 18-week waiting time target has meant that money flows through acute hospitals, with many of them racking up very substantial surpluses, leaving insufficient funds for absolutely vital mental health services. Many mental health trusts have suffered a real terms cut in funding, and that is totally unacceptable. Well, what is the result of that? Well, whereas if you suffer a physical health problem, you will get your treatment now within 18 weeks from the time you see your doctor, in mental health, you can be left waiting often for far more than a year before you get access to treatment. And if you're old in mental health services, you may never get any treatment at all. You simply have to rely on medication. That is totally unacceptable. It is also totally unacceptable that the state of many of our inpatient mental health wards are intolerable. They are dreadful, hidden from public view. They would never be tolerated if they were in our local general hospital. It's also completely unacceptable that mixed-sex wards continue today. The Mental Health Act Commission described as truly scandalous the fact that women patients in mental health wards are often put at risk because of these mixed-sex wards. and youngsters under the age of 18 still placed in adult wards, that is totally unacceptable. And so many people languishing on incapacity benefit, waiting for treatment that could get them back to work with no help from the system. 3/4 of those at the non-acute end of mental health problems are receiving no treatment or support at all from the NHS, neglected by the system. 70% of prisoners suffer from some sort of mental health problem. And those from black and minority ethnic communities are overrepresented in inpatient wards. That is unacceptable as well. So we call in this motion for a core package of care: the right to information, the right to advocacy and support, the entitlement to treatment within a defined period of time. I absolutely accept Evan's helpful motion. No one should be waiting more than 3 months for treatment if they are suffering from a mental health problem. The motion commits to ending mixed-sex wards. Tony Blair said that it should not be beyond the wit of man to achieve this. That was before 1997. It's been beyond the wit of this government to achieve it. This motion calls for a prohibition on those under the age of 18 being put in adult wards. It addresses the plight of those who are on incapacity benefit, helping them back into work. Liberal Democrats, there's been a failure of successive governments condemning millions to live as second-class citizens. This must end. I know that this is a spending commitment, but be very clear. These demands have to be achieved within the £100 billion that we spend on the NHS. In a civilised society, nothing less will do. I commit that I will champion the cause of mental health and those who need mental health services for so long as I am doing this job and beyond. I want our party to champion this cause as well. Support the motion as amended.
Thank you very much, Norman.